Sonoma County's largest provider of emergency services is pushing for a big raise in how much they charge for ambulance rides. The Sonoma County Fire District requested a 16% rate hike over 2 installments. The district recently took over a much larger service area and says the rate hike is long overdue. Our Brad Hamilton breaks down the numbers and how officials are justifying the request.
An ambulance ride here in Sonoma County could cost more in the future, but the agency behind that ask say they're doing it for an exact reason. We got a chance to sit down with the fire district, why they explained they're going to ask for this raise and who it could ultimately impact. 2 years after taking over as the county's largest ambulance provider, the Sonoma County Fire District is asking for an overall 16% raise increase after failing to receive permission to raise rates by 25% last year. Deputy Chief of Operations Matt Windrum says they're projecting about $40 million in revenue, but more than $42 million in expenses, leaving a shortfall they say they can't sustain.
Having an increase in our of 6% in that difference in revenue and expenditures is very, very reasonable, especially when we look at what's gone on with cost of fuel. We have a well-compensated and dedicated workforce.
Deputy Chief Windrum pointed out that about 80% of their patients are covered by Medicare or Medi-Cal, with lower fixed reimbursements. As a result, the district says any rates increased would be targeting private insurance, which makes up a small share of calls, but a larger portion of billing.
These rates are still amongst the lowest in the Bay Area and would still be below what was bid by the other bidder even in 2024.
Santa Rosa resident Jay Newman told us that they'd support the raise at almost any price.
When you look at people that make tons and tons of money, and then I look at EMTs, and I go, wait, these people are saving lives, they're going into questionable situations.
It needs to be where it makes sense for people.
While Sequita Muldrew says with everything already costing enough as is, it would hurt to see an ambulance ride get more expensive for anyone in need.
Those who know more about it, hopefully they can dig really deep and find what's going to make the most sense for everybody.
Under the county contract, rate hikes above 10% can trigger a financial audit, but the fire district is requesting this be split into smaller increases, with a 9.9% as soon as possible and the rest in January of 2027, potentially avoiding that threshold. Deputy Chief Windrum says that has nothing to do with trying to trick the system. They simply need whatever they can get right now.
Being audited and reviewed on a regular basis by the county in a number of different ways where we stand strong with our performance. The need for the rate increase is really a timing issue in that there is a lag for us to get the rates increased both by the county and then our board has to take action on it as well.
For now, no decision has been made by the county's health services team, whose recommendation would then go to the county's Board of Supervisors for a final vote. We did reach out to the County Health Services Department, who did acknowledge that they are reviewing this pitch, but did not have time to comment further today.